All right, we're back on this Thursday night, everybody. Karen Hayden is here. She is a health nurse practitioner with Wellness Solutions, and we're going to give you some contact information a little later in this broadcast, so have a pen and paper handy because you will want to be contacting them. Thanks to our callers who are holding. Hang on for just a minute because I want to talk real quickly about integrated medicine. I'm fascinated by this whole new push.
Sure.
I've read a few books by Andrew Weil, the
Great.
doctor
Yes.
out in Arizona, who's really pushing for this, kind of the combination of traditional
Sure.
and natural medicines, medicines that have been around, for practices, been around for hundreds, if not thousands
Sure.
of years. And I love the idea of integrated medicine. Talk a little bit about Wellness Solutions and how
Sure.
you work on integrated, because I know you talked a little bit about supplements and the natural side of things.
Well, first off, traditional Western medicine, I respect it, and it definitely has a place. It has been around for a long time. And
Yeah.
so I believe that integrated is bringing those useful things in, but then also kind of looking outside of the box at not just what is your symptom and how can we treat that symptom, but you have chronic fatigue. Why? Why do you have chronic fatigue? What happened 4 years ago when you first started feeling tired all the time? What happened before that? What were you exposed to environmentally? How did you change your diet? Was there a big stressor at that point? So basically you have the toolbox from traditional, if you will, Western medicine, pharmaceuticals, and then you also have now what we're starting, well, that's been around for a long time, but now the medical world is starting to look at it, not just herbologists
Right.
and natural doctors, but how herbs are useful, and how much of a role diet plays, and how much sleep plays into things. So at Wellness Solutions, what we do is we do have pharmaceutical grade supplements, and we don't have a box that we fit like each patient that walks in, oh, you have PCOS, this is your supplement regimen.
It's
Not
customized.
It's very customized. Our treatment programs are customized for each patient. Like I mentioned earlier, we do have a psychotherapist who's available if a patient needs counseling or talk therapy. We have psych NPs who are available if someone is in an acute, stressful situation and they're experiencing high anxiety, extreme insomnia, lots of depressive symptoms, and they need to be seen acutely and might need a pharmaceutical psychotropic medication for a short time. I work a lot with our psych NPs who have patients who come in. They're working with them for a while on their psychotropics. The patients are ready to come off of them, or maybe they're still having symptoms, because things like thyroid dysfunction can play a huge role in depression. Vitamin D deficiency, not having enough omega-3s, the diet being off. If someone is sensitive to gluten and dairy, if they eat it, you can see a lot of not just bowel upset, but a lot of irritability, insomnia, skin rashes. So when we can take all the pieces and kind of bring them together and look at it as a whole, then and that's what I see as integrated medicine, is being able to use all the tools that you have available.
How long does it typically take with a patient to start really seeing some results?
Honestly, you can see results within the first couple of days.
Really?
I do spend a lot of time with patients for the first visit. It's typically an hour long. They usually, are not very happy about filling out the book length paper that I have them fill out, but I do read it, and it is very useful information for me.
Sure.
So that kind of guides their first visit. I go through their symptoms, and then it kind of helps unravel their story and let me know when symptoms presented and what life
Do you
factors.
do blood work or any kind of tests like that if necessary?
We absolutely do. I do a pretty extensive panel of blood work. I test inflammatory levels. I test glucose. I do the hemoglobin A1C, which is a 3-month picture of blood sugar. I do the lipid panel. I do hormones, and a pretty extensive thyroid panel. A lot of times if you just go to an internist or your PCP and you tell them you're having hypothyroid symptoms, which are fatigue, weight gain, depression, constipation, those types of things, they'll run a thyroid level. But what we're finding is that if you have adrenal fatigue, your TSH can still look normal, which is the level they usually draw, but the other levels, the T4 is not converting to T3 properly because your cortisol is too high, that kind of thing. So we do that. We also offer saliva testing for hormones. We do a nutrition panel that is through blood spot testing. We can see what food sensitivities you might have, food allergies you might have. So we do have a lot of tools at our.
People may have food allergies and not even realize it.
True, and what I'm seeing now is more than food allergies, which is what you would think of as like an acute, anaphylactic reaction or a hives right away, or vomiting, something where they're really.
Like to peanuts or eggs or shellfish you hear about.
Exactly. Now what we're seeing is a lot of sensitivities, not allergies, but sensitivities,
Right.
and it's different antibodies that your body's producing. And the symptoms tend to show up not necessarily acutely, but usually about 2 or 3 days later. So that's pretty confusing for someone if, say, they're sensitive to eggs. They ate eggs on Friday. On Sunday, they feel horrible, and they're thinking, all right, what did I eat this morning? Not realizing it was Friday. So there are a lot of food sensitivities, and usually that is because the intestines have taken some sort of insult over the years, whether it be a lot of antibiotics or a lot of steroids, or stress can even kill off good bacteria in the GI tract. So all of my patients are on, if they're being compliant, they're all on a probiotic, which is good bacteria, because when you put good bacteria back in the gut, it kind of does hand-to-hand combat
Sure.
against yeast and bad bacteria.